One of the quirks of dwarfism is that sometimes organs or parts of the body are the same size as they would be in a full-size animal. And with Coda, that's the case with his teeth. There's no real clear path for the air to get in or out. For me, that really scares me. It'd be nice to actually give something back to him, really make a difference to his life. When I had a call from Lynchy, who's an old vet mate of mine from uni, about Coda, I was blown away. He sounds like such an incredible little guy who's already been through so much.
Chris is on his way to the outer Melbourne suburb of Yarrambat, where he will finally meet the famous Coda.
In a few days' time, he's due to undergo a massive operation. I knew I had to be here and lend a hand.
Looking a little bit sleepy this morning. Right, little guy? Hey, want to go for a run?
Coda was born a dwarf, a genetic disaster with very little hope of surviving.
Hey Lynchy, how are you?
Hey Chris,
Mate, good to see you.
Good to see you.
Hey, you must be Karen.
Hi, nice
Hello.
to meet
Vet nurse Karen Stevenson stepped in to stop him being put down.
You are even smaller than I thought.
you. Just seemed like such a tragedy to end his life after only a few short weeks. He deserves a chance to be happy, and if we can make that happen, then it's worth every cent.
What's that? Is it a smile?
I think he's taken to you, Chris.
He's very special.
He's very special.
He's amazing.
Yeah.
Can I actually have a good look at it, how he gets around? Is that all right?
Of course, yeah.
He actually gets around all right, doesn't he?
At only 2 years of age, Coda has already endured several major surgeries.
You can see, though, how he limps there, Chris.
Yeah.
When he was still a baby, the fetlock joint on his left front leg had to be fused to stop it buckling. At last, he could finally stand up and walk. He hasn't stopped running since.
Go, go, go!
I'd been told stories about Coda, I'd seen photos, I'd seen videos, but when you actually see him, it's a shock. He's tiny. He barely comes up to my knees. I've seen Labradors bigger than Coda. The list of Coda's medical problems and previous surgeries is bigger than he is. With all this talk about operations, it's easy to forget about what Karen and Lynchy have done for Coda. It would have been easy for them to walk away and just have him put to sleep, but no, they stuck with him. They believed in him and made huge sacrifices. Karen's put off her house deposit just so she could be there and pay for all of Coda's treatment. It's pretty amazing.
The pint-sized celebrity also carries out his own charity work, raising money and doing regular rounds at Melbourne's Royal Children's Hospital.
Lammy's gonna pat him.
Lammy's gonna pat him. Oh.
It's uplifting. It's fantastic to see the kids' reactions. It's just such a delight taking him in there and seeing the change that it makes to everyone's day in there, not just the patients, but the patients, the children's parents and the staff of the hospital. I think he likes you. He wants to have a good rub.
Pony.
Pony. Oh, look, look.
I think he's saying, you tickle me, now I'm going to tickle you back.
But today, at the Yarrambat Clinic, it's time for Coda to become a patient once again.
One of the quirks of dwarfism is that sometimes organs or parts of the body are the same size as they would be in a full-size animal. And with Coda, that's the case with his teeth. He's got full-size adult horse teeth inside that tiny skull of his. That tooth there is that big.
That's right. Yeah, it's hard to imagine, isn't it?
In tiny Coda. The thing that I find most scary about this X-ray is that it's just a head full of teeth that really obscure him breathing in through his mouth, in through his nose. There's no real clear path for the air to get in or out. For me, that really scares me. Everyone's experienced a toothache, but what Coda must be going through with multiple teeth penetrating into his sinuses, causing a pressure build-up, pressing on his eyes, pressing on his brain, it must be horrific. If we don't do anything about this soon, then it will kill him.
Inside the Yarrambat Clinic, Australia's smallest horse is busy raiding the staff lunches.
Oh, Coda. Coda, you can't eat that. That's someone's lunch.
Coda's happily unaware he will soon have to undergo major surgery to remove the massive teeth that are shutting off his air supply.
It'd be nice to actually give something back to him, really make a difference to his life, remove that source of pain, remove that pressure, and actually make him happy again.
Today's tracheostomy is step one of the risky procedure.
By putting this tracheostomy tube into his windpipe and allowing him to breathe through it, we then free up space for the surgeons to go into his mouth, go into his sinuses and work their magic. Without that, there's just no way for him to breathe under anaesthetic. For me, it's amazing that he's actually got this far. There's two really large arteries, two really large veins and a really important nerve that are right next to where we need to be making this cut, so that's always going to be the biggest concern. It's the really crucial part now. We actually need to cut into the windpipe. Then we place this tube in that space and hopefully that's going to be the job done.
Nice job.
And we're in. That now becomes essentially his new airway, his new way to breathe. All right, mate, I'm happy.
That's great, perfect.
It's an hour after the operation, walks out to his barn, has a look around, looks at me and goes, mate, you did this.
Hey, mate. Well,
He's gone. I'm in awe of his toughness, but the reality is he's got a much bigger operation still to come, and I really hope he's up to it. We'll see you in a few days' time, Coda.
see you, mate.
See you, mate.
Coda's very good this morning. He is breathing very well after his operation the other day.
3 days later, Coda heads to the city with Andrew and Karen for the operation that will hopefully save his life.
I can't help but be a bit nervous, I have to say. Yeah, I guess it is a bit like having a child going in for an operation. You do feel a large responsibility and you just hope that you're doing the right thing by him. He's just got to get through today.
Cool, buddy. It's an amazing amount of teeth in that small space.
Absolutely, unfortunately, yes.
Associate Professor Gary Wilson, a specialist horse dentist from Queensland, is doing the surgery for free.
It's right up there with doing wombats and koalas, okay, for difficulty.
Can see anything like
Okay.
No, this is definitely a first for me.
Associate Professor Andrew Heggie, an oral and facial surgeon at Melbourne's Royal Children's Hospital, is another volunteer on this elite surgical team.
Well, I've been drawn into it because of the problems of the dwarf miniature pony and some of the problems related to the jaws and the teeth. Coda visits from time to time and the children's eyes nearly pop out of their heads when they see him pottering by, this miniature horse that's actually alive and not a mechanical sort of device. And I think we want to keep him in good health for as long as we can for obvious reasons.
The potential for catastrophe is great. One slip the wrong way or an anaesthetic complication and things could go disastrously bad.
So that back edge is actually still molar 1, molar 2 hasn't even erupted on this guy yet.
Coda's complex operation to save his life has begun. Within a few minutes, Chief Surgeon Gary Wilson has to make a tough decision.
First off here is I can't get my finger back to the tooth that I need to extract. So we're going to split him. I'm going to do a bilateral commissurotomy, which means basically I'm going to make him smile bigger, temporarily. Righto. What I'll get you to do while I'm cutting is if you can stretch that for me.
Sure.
That tightens that, which gives me a better cut.
Yeah.
Pretty drastic way to get a look at the teeth.
It is certainly horrifying seeing him with his face split open, but no, he's all right. He's in good hands.
Now we got access, because that's the tooth I need is 1, 2, 3, 4. So, time to take a tooth out.
The surgical team has now reached the critical moment. If any of Coda's teeth break off, Gary will have to drill in through the skull.
The hardest thing here is just keeping your patience because this is a really delicate yet forceful procedure at the same time. It's a bizarre mixture of strength and patience.
I can actually now move this tooth a little bit with my finger. All right, let's try a lift. Oh, that's tight. Whoa, Junior.
We've now got it about an inch out of the socket. But the problem is this tooth is up to 4 inches long. To actually get it out inside the mouth is quite a task because it just won't fit to come out. So really trying to suck it back in, isn't it?
You can hear that vacuum then. Go, baby, go. Uh-oh. Oh, crap. Crap.
Change of pressure.
We've just hit a little stumbling block in that we've raised the tooth out of the socket enough that unfortunately it's hitting the other teeth on the other side and it needs to come up along. I've got to somehow get it past these teeth on the other side and I'm not too sure how we're going to do that yet.
The surgery has now been going for more than 2 hours.
It's coming a little bit at a time. Yeah.
At last, the team's patience is finally paying off.
Yeah. Go, baby, go.
Oh, it just keeps on coming, doesn't it?
Mighty.
Oh, here we go.
Oh.
Wow.
Oh, my goodness.
That's extraordinary, isn't it?
Sure is curved.
Look at that. And you look at that there, inside that tiny skull. The maths just doesn't add up. And Coda's really paid the full price for that. That's incredible. This is the first tooth cleaned up. It's just absurdly large. And this is enough to put the tooth fairy into liquidation. It's ridiculous.
After another 30 minutes, the second tooth is ready for extraction.
Well done.
Here we go.
Oh,
Jeez, well done.
it's a boy.
That's it there.
Done. Well done, team.
No, mate, well done you. That was
fantastic.
extraordinary.
Great stuff.
Now we just got to put Coda back together.
Yeah.
Very happy, yes. Yeah, no, all's gone swimmingly well.
For me to be a part of this surgical team and actually take part in this operation for Coda is special. But to know that it is a life-saving procedure, it's really something. You just need to look at the faces of Lynchy and Karen to see the relief.
We expect so much maturity of him, don't we? You forget that he's just a little baby.
It's a tough little fella.
He's a tough little fella. Made us all very proud, mate.
Incredibly, Coda is back up on his feet only 15 minutes later.
Take it slowly now.
But it will take him at least a month to fully recover.
He's going to play the little tough guy and carry on as though he's in no pain at all, but he'd be feeling it right now.
You're a remarkable little fella.
He's a small little man, but he's had to become a big guy on the inside to go through and overcome all these hurdles. How's the patient this morning?
He's doing really well.
Yeah.
He's got a little bit of swelling in his cheeks.
Yep.
But his appetite's back, and we're really pleased with how he's going.
Next day, Chris meets up with Andrew and Karen to check on Coda.
Oh, look at you. What are you doing? You okay? The check is there. No tooth under there, so tooth fairy's obviously big.
Tooth fairy's big.
Yeah.
After his surgical ordeal, Coda is living up to his reputation as the Iron Horse.
He looks like someone that's had their wisdom teeth out, doesn't he?
He does, yeah. He's got that real chipmunk look about his cheeks.
Yeah. I've got to say, I mean, you look at what he went through with that operation yesterday, it was quite a forceful procedure, but true to Coda's nature, he bounces back, shakes it off, and away he goes. You're back on track now, aren't you? Nothing's going to stop you. More food?
Literally within an hour of the surgery, he was looking around for food, doing his old normal things, you know, sort of bumping up against us, wanting a scratch, being his old normal self. And I was just absolutely chuffed to see that. He's got a lot of character, Coda.
The dwarf horse, who is not meant to live longer than 6 months, will now be around for many more years.
Coda, just slow down, buddy.
A lot of kids look at Coda and they want one. He's a very cute little pet. Coda is not an ideal pet at all. I wouldn't encourage anyone to take on a pet like Coda unless they are specifically able to deal with the many health problems that his condition entails.
Knock, knock.
Only 6 weeks later, Coda is back on the rounds at Melbourne's Royal Children's Hospital.
I think he's very cute and he loves to see people, like to come and visit kids here at the hospital. I think he's nice and soft.
Hopefully now the little horse's battle against chronic pain is finally over.
He has been through a lot. He has been through significant periods of convalescence where he's had to overcome significant surgeries. So yeah, I think he can probably relate to the experience of being in hospital. I think he can continue doing his good work here, and he obviously brings a smile to all the kids' faces here. It's fantastic to see. So the team's back together and we're hoping to have many good years together.
I'm lucky enough to see animals every day of my life, but there aren't many that come along like Coda. He's the smallest horse in Australia, but he's one that's probably left the biggest mark on me.
Hello, Trouble. Hello, mate. Hi, handsome boy. Who's this?
This is Camino. He may have some lipstick on his...
He really does.
Yeah, sorry
he's
about
smothered
that.
in lipstick. Whose is that?
Might be mine.
Right. Wow, so he's a hit with the ladies there. Hi, handsome. Camino is one of those cases that, well, makes your blood boil. So this is the dog that we've kind of rescued, is that right?
Yeah. He's 13 years old. You can see he's a golden retriever. And we rescued him from a family who didn't really want or care for him anymore.
He looks quite thin as well. Did I mention, had he been eating okay?
Well, he's been in a garage by himself. And the alarm bell for me was that he didn't fit in with their decor in their home anymore. So he was actually just in a garage 24/7. So no one's really known whether he's been eating or drinking.
He is just a neglected dog who deserved a far better life than what he was given. And actually, there's no reason why he didn't get it. He came from a family that was very financially secure. They didn't let him wee on their grass. He just simply was unloved. Well, he really is such a sweet-natured dog, isn't he? And I'm sure that we can give you the affection that clearly you're looking for, hey? But yeah, I'm a little bit concerned about how thin he is and the fact that he is breathing quite fast. He's not too bad. He's got some pretty mucky teeth in there. Cataracts, which is not a surprise, being an old boy. That's the greyness you can see to his eyes there.
Can he see?
He will be able to see a little bit, but it's kind of like looking through mist.
Okay.
So he's going to have old dog problems, aren't you? The thing is, look, this guy, yes, he's got some issues with movement. There's no doubt about that. Oh, and you've got an issue with toileting outside, which is fine. We can sort out that. Let's pull you out of your big poos. It's not a surprise that he's a little bit incontinent if he's been living in a garage and not being walked. But he's such a sweet boy, aren't you? You're a sweetheart. Hey, you. He's got a beautiful golden retriever smile, hasn't he?
Yeah.
Just classic. So I think first things first, we'll take some bloods, Nathan. Do we know what his name means, Camino?
Yes, it means walking.
The irony. Camino the dog that never gets walked. Unfortunately, there is a chance that Camino could be quite unwell. He is an old dog and he's been neglected, so yes, we don't expect him to be a perfect physical specimen, but there's just a few little warning signs here. The fact that he is really out of breath, his gums are a little bit pale, and he's very thin despite the fact that he has been being fed and he's been eating well. So I'm a little bit concerned that there might be something that lies beneath which is not particularly good. Yeah. Okay, so he's anemic, which makes a lot of sense. That's why his breathing is as laboured as it is. Okay, so he's losing blood from somewhere. Yeah, so I think let's do an ultrasound just to make sure that he's not losing blood from anywhere that he shouldn't be.
I have to say I'm a little bit concerned.
Yeah. All right, take it easy. Ready? Come on then. That's it. Good boy, well done. Ready? Oh gosh. Oh, good. There we go. Good boy.
What happens when the gym's closed during lockdown, isn't it?
That's right. You have to pick up dogs and put them down again times 10. Sometimes in old dogs, particularly retrievers, can develop tumours in their spleen or in their liver, and they present as anemic. So it's a pretty good result. I can't find anything untoward there in this scan, which is great. I was a little bit concerned. Thankfully, I'm only finding normal structures present in his abdomen. So it's good news. I think what he needs is just to be looked after and loved and fed well. Okay, come on then, more gym work for me. Ready? Lockdown gym. Okay. Look. Bicep curls. Come on. Handsome boy. Go. Oh, you're a big boy, aren't you? We were introduced to this dog as a patient of ours. This dog wasn't being cared for and loved in the way that it deserved, and therefore we felt as a practice that the right thing was that this dog should find a new home, and that's what we did.
We are coming to the practice today because we are rescuing a golden retriever. It's nice because we're doing it for the dog, so it's lovely that we can offer him some TLC and a new home for the last years of his life.
It'd be really nice to give him a decent couple of years, however many years that may be.
Here you go, here he is. Hi guys. Hi. This is your new doggy.
Hello.
Say hi. No, I'm not going to introduce him by his name because I don't think he should have that name anymore.
Right.
I think he should have a name that you guys decide. So he's basically 13 years old.
Yeah.
He has some joint issues. He has some sight issues. Now I understand that you guys have had quite a lot of old dogs in your recent history, is that right?
Yeah, we're pros when it comes to elderly dogs and their care, yeah. He can look forward to lots of flat floors, lots of treats, lots of TLC. We basically have someone at home 24/7, so he will never be on his own. He'll have a whole new set of like doggy friends to meet up with.
It sounds like you guys are from the heavens. Really? Amazing. Yeah, Lizzie has been the saviour of this dog, but now, like any good fairy godmother, you've got to, or dog mother. You're the fairy dog mother. You've got to pass on this doggy to you guys.
Yeah.
So, yeah. Come on in. Come on, up we come. Come on in. Hey, good boy.
Yeah, okay, no more lipstick on your head.
Bye guys.
Come on. See you later.
Bye. Lots of love. Thank you so much.
You're welcome. See you soon.
See you soon. Bye. Today I'm so excited because I'm about to be reunited with the absolutely beautiful old boy. Previously his name was Camino. I don't know what his name's going to be now, but he got to go home with the really lovely Harris and Camilla. Hello, hi, it's me, Nikki.
Yeah, how are you?
Oh, I'm good. Hello, buddy. Oh my gosh, you look amazing. Wow, you look so good. His coat looks amazing.
Oh, thank you. We've given him a really good brush.
Oh, so we go and see your new house?
Yeah, come in.
Thank you.
Doggy bear,
Come on then. Come on, big boy. Well done.
Good lad.
Good boy.
You know my kids, Harris and Camilla.
Hi, guys.
And this is the old boy's new family.
Wow.
Would you like that?
Hi.
There you go.
Wow.
Oh, maybe she'll take that from him now.
Wow, I knew he was joining a family. I didn't realise he was also joining a pack.
Yeah.
Well, look, first things first, I've been dying to know. He had a name before, but I don't think we should dignify that name. I want to know what the family's come up with. So what have you called him?
We called him Doug.
Doug!
We've all, as a family, we've seen the film Up, and the dog in Up says, "I have just met you and I love you." And when Doug came home, that's what he was like.
And he looks so good, doesn't he, guys?
He is very content. He loves his family.
Doug is looking the picture of health. Of course, he's an old dog, so he's got the classic issues of arthritis, which he will have for the rest of his life, but his coat looks amazing. He looks so much brighter. His gums are nice and pink, but he just seems to be a totally different dog. But I think more than anything, you're getting a real happy vibe from him. He just seems
so
really content
happy.
and really happy.
He is really happy. Well, he just makes you fall in love with him. The whole family's fallen in love with him.
Should we go for a little walk? Should we go for a walk? Do you know what one of those is yet? Eh? It's where we find a lead. Yes, a lead. A lead.
Maybe on the third day we took him out for a walk. It was almost like a switch clicked. And he went from being a dog that's 13 and a half to a dog that was 3 and a half. And that was sort of when we realised that he was going to give it 110% every day. And he does.
Here as well.
Hey, look, come on.
Doug enjoying the great outdoors. Now he can smell the flowers, he has grass under his feet, he can walk in the fresh air, he can listen to the birds. This is a dog that has struggled with arthritis, he's been quite painful, he's been on cold concrete floors. Well now, what a difference a few months make. He is living in the lap of luxury and he gets to enjoy wonderful, beautiful, open green spaces.
Him being outside is where he's happiest, and he just wants to make up for everything that he's missed out on. He wants to do twice, 3 times over, and he wants to give it his all the time.
Ready? Good boy, well done.
Hello, how are you? G'day Sophie, how you going?
Hey mate.
Hey Ron. Hey Sophie, how are you? This is Farley, isn't it?
It is Farley.
Hello Farley, how are you? You good? Speak? Good.
Chris is keeping a special date at the Children's Hospital in Sydney's West. He's made a promise to help one of Australia's most inspirational little girls, Sophie Delizio.
Do you want me to get it out?
Sophie has just the most incredible story. I'm sure everyone's heard about it. A car crashed into her childcare centre and caused her to have third-degree burns to 80% of her body. She lost both of her feet, but the staff here at Westmead, they saved her life.
And this is its kennel.
Now Sophie has her own Day of Difference Foundation to help other critically injured children.
Is this Jack?
This is Jack, yeah.
Today, she and Chris are handing out Tara dolls, named after Sophie's first assistance dog.
My dad thought that it would be a good idea to call the dog Tara as a remembrance of my dog. She was a good help to me and I really did miss her.
From the same litter, I reckon.
Sadly, Tara passed away 2 years ago. Sophie's now waiting to get another 4-legged helper.
Drop, roll over. It's a high 16. I never cease to be amazed at the impact that pets can have on kids, and when they find themselves in horrific situations where they're going through a lot of trauma, a lot of pain, an animal just can soften that whole experience. And that's why I'm so behind pet therapy, because it does work. It really does make a difference. Can I do one more?
Yes.
Sally, speak.
I was so mad. It does help blocking your ears. Makes me feel really happy that they have something to enjoy while they're in hospital.
Okay. No worries at all. It's our pleasure. And look in their faces. They forget about everything else and just see this little puppy dog in front of them, and that's what it's all about. You know, just for those few seconds, nothing else matters.
Mobile vet Audrey is on her way to a special rescue centre that's become very close to her heart.
Possumwood is a wildlife sanctuary just outside of Canberra. It's in a town called Bungendore. It sits on a really beautiful hill and they really house kangaroos, wombats, possums, rehabilitate them, and just a safe area for wildlife to hang out and recover.
We're in prime kangaroo habitat in this area, and so many are either shot, chased by dogs or hit by cars. And so we felt that they were the animals that really needed our help most.
Audrey has been volunteering here every weekend since devastating bushfires in the region left hundreds of injured kangaroos struggling to survive.
Hi, Rosemary.
Oh, hi, Audrey.
Nice to
you
see
come.
you.
Thank you for coming again.
No, that's
looking forward
okay.
to another
We are
busy
looking
weekend.
forward to another busy weekend. How are all the girls going?
Oh, they're doing really well this week, not compared to Audrey has been a godsend to us because she actually relates to the animals. You can see she loves animals. It has made our job so much easier because it's very difficult anyway, just looking after these animals, the amount of cleaning and care that we have to do. But the veterinary treatment would have been very problematic without Audrey.
Today's first patient is Hipster, a victim of fence hanging.
Hipster is a joey, a little kangaroo that we've been seeing for a couple of weeks now, and he got stuck in a fence with one of his legs, which is quite common. So what he was doing when he was trying to free himself is that he damaged the bottom of his foot. He actually fractured a toe, he severed a tendon, and he dislocated his hip. So we fixed the soft tissue injury, we actually amputated one of his toes, and we took him all the way down to Sydney, to Northside Specialist Hospital to get a hip surgery done.
All right, ready for us to start? Beautiful. That was actually really exciting.
So far that's all gone really well. And today we're going to check that all out and see how it's healing. Oh, that swelling's gone down heaps. That's amazing. Wow, that looks really good. There's pretty much no swelling around the surgical site, which is amazing. And certainly today, Hipster is a lot more comfortable to just move that leg and manipulate that joint. Prognosis looks really, really good in terms of recovering faster than I expected. Finished looking at the surgical site. I'm happy with how that's going. So I moved down to his foot and we're having a look at the bandage there from the old surgical site. And I'm a little bit bummed. It actually doesn't look too great. So the area has actually opened up and the wound has actually started to get infected and the skin to die off. The injury from the fence and the barbed wire is so bad it can cut off the blood supply to that area of the foot. So even though we suture everything back together, we remove the broken bones, the wound starts to break down a couple of weeks later. So that's what's happening. So that wound is breaking down and on top of that we're getting that pus. So the main thing we're going to have to do here is just remove everything that's dead as much as we can, try and get rid of that pus and infection and then start him on good antibiotic control and then hope that we can get on top of that infection and it doesn't affect anything we've done up here because this guy's been through so much already. So hopefully that isn't going to set us back too much. So what I'm going to do now is just flush that wound and all that pus away with some saline. So the way we've been doing since the beginning with even the burn victims is just getting a saline bag, sterile saline bag, cutting a hole and then just using it like a little washing machine flush and just shake. Shake it. I've just cut away all the dead tissue. Doesn't look great because it's got a gaping hole in the middle of it. But what we're going to do is try and get it to heal from the inside up. So it's called secondary granulation tissue. And then once that tissue fills in the defect, the skin should crawl across and close as long as we keep infection away. I'm confident he's going to pull through. I'm confident that that wound is going to heal and then we're going to see him go home.
How you going? How are you? I'm Chris.
Yeah, Ron Harriman.
Lovely to meet you, Ron. I thought you had an animal. Sorry. Come on through.
Over the years, there's been many presents from grateful patients.
So you're an artist, are you?
I saw it and I couldn't resist painting it.
But today, Chris is about to receive the ultimate compliment.
I'm a bit nervous, Ron. I don't know what to expect here. Ron, that is very, very special. Don't know why Ron's come here first with it, because surely there's still time to enter the Archibald, isn't there?
Thank you.
It's very kind of you.
Could I have a photo taken?
Yeah, of course.
With it? Paintings are better than photographs. They fade and they get thrown away, but you've got a painting for life, haven't you?
Smile. Now I just have to find the right place for it. I've got an idea.
All good, but Neil, the clinic manager, has to give the final seal of approval.
Fantastic. Yeah, it's good likeness. Yeah. I like it.
What I like about it being in here is that it's understated.
Very understated.
It's very modest.
Very modest, yeah.
The best thing about that picture is the fact that it's Lisa's dog that I'm photographed with, little Lucas. So that means I can give it to Lisa, right? Christmas, birthdays, combined.
Oh, it's really nice what that guy's done.
No, it is actually really nice.
Yeah.
Oh, it's just another day.
It is.
Dear Lisa, I just knew you had to have this. So happy birthday. Yes, I'm a bit early.
Maybe it's a huge box of chocolates.
Yeah. It doesn't feel like chocolates.
There's no way he wrote this. This has to be a
All right.
Oh my lord.
It looks exactly like Lucas. It does. It looks better than Chris. Oh no! Look at it. Oh, Lucas looks amazing. Lucas looks unbelievable. Chris is wearing lipstick.
I don't know why Chris has given me this picture. I think, I don't know what he wants me to do with it.
Is that for you to go on your wall at home?
I'm just trying to decide what I'm going to do with that.
Yeah, that'd stop you having babies for a while.
I think so.
That's enough. I think that'll work better until you can take him home, Lisa.
I've been an ambassador for Assistance Dogs Australia for years now, and I've just had a call from their CEO, Richard Lord, to tell me that one of their dogs has gone into labour. Now, that's interesting, but what's really fascinating is where she's giving birth right now.
It's 11 p.m. and Chris is heading to a very unusual maternity ward.
Our girl's giving birth in jail.
At the Emu Plains Correctional Centre west of Sydney, Chris is met by the manager of security, Angie West.
So we've had one puppy?
Yep, one puppy.
Yep. There's no doubt this is an extremely strange situation to be let into a prison to deliver a litter of puppies. It's not every day you do that.
I'm Chris.
I'm Jodie. How are you going?
How are you?
For 10 years, Assistance Dogs pups have been raised by inmates in prisons around Australia. But this is a groundbreaking moment in the program.
When you remember that this is the first time ever assistance dog puppies have been born inside a prison, it's a pretty special night. And for me as an ambassador, it's one that I was never going to miss.
This is Brielle?
This is Brielle.
And she's just been panting like this?
Panting, yep.
No straining?
Only pushing the pup out, yep.
Prison inmate Jodie's been Brielle's carer for the past 4 months and delivered the first puppy on her own.
I knew something was going to happen. She gave me a look of help. Help me, please. I just patted her and let her know that I will be here for her the whole way through.
We've got a puppy just coming. Just let her give her a final push.
Yep.
Okay, and we're away. All right. Let's get this sack open nice and quickly. So we're wriggling, which is good. We're just going to tear that umbilical cord like that. Let Mum do her work.
The worry with a small puppy is that even a small amount of blood lost can be pretty significant.
I'm just going to tie off the umbilical cord. If you just hold her there.
Yep.
So that's why I go to the clamp straight away and stop that bleeding.
Yep.
X-rays have indicated Brielle is expecting a huge litter of 11 puppies.
The thing that I guess is worrying me right now is the fact that she's going to become exhausted no matter how she approaches this. It's going to be a long night for her. It's going to be a long night for all of us. Almost an hour since the last puppy. I just want to feel and see where these puppies are at the moment. She's still quite big, so we know there's still quite a few puppies in there.
I have a very strong bond with Brielle. These pups are so special and we've had such a big involvement in the whole process. They've become my whole world. Where's your puppies?
I can feel a puppy engaged in that birth canal, and from there it should be on the fast track on the escalator going out, but it's just sitting there.
The issue I have in that birth canal is it's narrow and it compresses the puppies. If it compresses those puppies for too long, then the blood no longer goes to their brain and you can lose them there.
So we might give her an injection and get things moving.
An oxytocin injection should induce stronger contractions.
All right, so we're getting some contractions here.
Oh, look.
Finally, Brielle delivers another puppy.
Here we go again. She might want to...
I don't think Brielle really knows what's happening. Yeah, got another contraction there. She's sitting and there's a puppy there. So they're coming thick and fast right now. Yeah, I said she had to move it along. I did. The fact is I'll take them lying down, sitting down, upside down. Whichever way they're coming, as long as they're coming out, I'm happy.
Oh, there we go.
We've now got 5 puppies out, but when you look at Mum, she's starting to look pretty tired, and that worries me because she's still got a lot of work to do tonight. And if we start to lose her, then all those puppies still inside of her are in big trouble.
Here we go.
Well done, girl. Man, that's a big one too.
Yeah.
Brielle has just given birth to puppy number 10.
This one's trouble. Straight away, you know. When they're born, it's almost like they're a member of the royal family. They can't hope to understand what lies ahead of them. They have this destiny. They'll grow into being assistance dogs, dogs with such an incredible purpose.
Anything more in there? Give us another push.
It's obviously been a big ordeal for her to get 10 puppies out to this point, but I guess she has to muster all her reserves for one final effort to produce this last puppy. Right now, it's really hard to tell whether Brielle's work is done or whether my work is far from over.
Yeah, they're better out than in. I wouldn't know that personally, but that's what they tell me.
There's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Where's the other one? Where's the other one gone?
It's been more than 30 minutes since Brielle delivered her last baby. X-rays had shown she was expecting 11 puppies, but it looks like technology got it wrong.
She just looks like she is.
She looks like she's satisfied.
Inmate Jodie and Chris are now convinced the long labour is finally over for this patient mum.
So now I feel there and I just can't feel anything else. So I think that...
That's it.
That's it, yeah. 10's not bad.
Not done.
There comes a time in a young man's life where they ask you what you're going to be when you're older. And I can tell you. You're going to be an assistance dog, aren't you?
Well, this is just the start of something massive. They've got such an important role with people with disabilities. They're born to give the best to somebody that can't give the best to themselves. I would never have imagined being able to be a part of something like this.
They're in very good hands.
Okay.
All right, take care.
Okay, thank you.
No problem. I would hope after everything I've seen tonight and how amazing Jodie's been, that assistance dogs might look at her and go, you'd make a pretty good puppy raiser and she can have at least one of these puppies.
You're such a good girl. Yes, you are. You're such a good girl. I can't describe the love I feel already for Brielle and these pups.
Dr. Chris, how are you?
Good, how have they been going?
Oh, great. They've just grown so much.
Chris is back at the Emu Plains Correctional Centre to visit Jodie, Brielle and the 10 assistance dog puppies he helped deliver.
Have we got enough? Typical prison officer, always counting.
They're just bliss. Look at these animals. They are gorgeous. So, oh, he's kissing me. He loves me.
It's a nice thing to come in and see the impact that it has with people that are working with them and also the inmates. It's life-changing for them.
It brings out a good side. It brings out a caring side and loving side. And I guess here you don't really get to show that.
She's a very good girl.
You're a good boy. Being able to give your love to these animals gives you back your love.
Within weeks, the puppies will be leaving to start their training. It's still hoped Jodie will be able to raise one of them here.
They're going to make a big contribution, and Jodie's been a big part of that.
Be a sad day when they go. Yeah.
Hi, I'm Dr. Kate. If you enjoyed this video, don't forget to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content. And if you love Bondi Vet, go and support us by checking out Bondi Pet Marketplace at bondipet.com. You'll find a whole range of great Aussie pet products and services. We can't wait to see you there.